Hey everybody, this is Cara for BFR University, doing my BFR Tuesday, answering any questions regarding BFR that you have. So I usually will spend anywhere, it depends on how many questions, 5 to 15 to 20 minutes answering questions during my lunch hour on Tuesdays. So if you've got something specific, please type it into the message bar and ask away. Hello, Louis. So what kind of questions do we have today? BJ, can we do a body weight workout with both upper and lower straps on at the same time? I don't recommend it because when you think about it, all the fluid in your body from distal to the cuff is going to be trapped. And so the fluid that's in here is going to be much less. And so if you, so cardiac output, the amount of blood that your heart is pumping through into the atrium and aorta is a component of heart rate times stroke volume. So if we have all this volume down here is reduced, in order to get the same amount of cardiac output, I've got to increase your heart rate. So your heart rate will go through the roof. So I don't recommend ever using upper and lower extremity cuffs at the same time. I would do, you could do lower and then do upper, or you could alternate, but I don't recommend it, at least with our cuffs. There's some other cuffs out there that do not cause occlusion, and you'll see people on Instagram doing like plyometrics and those types of things with them, and you just know that they're not occluding blood flow appropriately or effectively, because you just can't do it. It's too hard. So thank you. What's the secret to turning the sound on? My sound's on. Can anybody else not hear me? You might have to go to microphone off. Maybe just hitting volume on your computer or your phone or whatever you're on. Any other questions? Sedentary protocol was mentioned in a previous session, doing 5 minutes on, 5 minutes off on setting high. What occasions would this be used for? And is it safe for the novice? Yeah, super safe for the novice because you're not doing any exercise with it. You use it for recovery. I also use it for people if I'm trying to improve the body's ability utilize oxygen effectively. I think that when we cause this type of occlusion, 5 minutes on, then reinflate for 5, you're causing a stress to the system, and so your muscles have to get better at utilizing the oxygen that's available. And so the ability for the oxygen to get from the blood and into the muscle or the tissue improves when you use this type of protocol. It also, I think, stimulates vascular endothelial growth factor, which helps with capillarization. I think that it makes the tissue healthier. I would do it. I would do it while you're watching TV or just hanging out after exercise, just as kind of a health promotion. We don't really talk about it that much as like that, but if you look at guys like Dr. Mercola, he would talk highly about, especially in older individuals that maybe can't exercise as well, to doing these types of protocols to help the oxygenation and oxygen saturation of the tissue. BJ, what is a good introduction and progression to begin with BFR? Send me an email. Do it to smarttoolsplus.com. And what I'll do is I'll get you on my app. And I have a 2-week, or I think it's a 3-week BFR protocol that you can utilize when you're in there. And it gives you exercises, warm up, little introduction videos, stuff like that. I'd be happy to share that. I'll get you on there, register you for that. Can everybody else hear me? Troy's having a problem hearing me. How about if I turn up? Is that better? Audio is good. Okay. Troy, I'm sorry. It must be something on your end. Maybe look for Bluetooth speaker or Bluetooth headphones around or something that might be getting, or it's not connected to your speaker. Okay. 4-week-old baby in the house. Yeah, I can't imagine doing anything with a 4-week-old baby in the house for sure. And Emma, yes, please send me an email. Anybody that wants to be put on the app, I'm happy to add you, and it's an on-ramp program. Oh, Keith, how often for sedentary protocol? It's a good question. We don't have any long-term studies to back up what I'm saying. So from what I've read, you don't want to do it more than like, I'm gonna say 7 days in a row, once a day. And then I would take off probably a week. I'd probably go week on, week off until somebody can come up with some data to validate what I'm saying. But, or you could do every other day would be okay, I think. There's some evidence, and this is in very, very high elite level athletes that, shoot, I'll never be at, that doing it too much or too much prior to your activity will reduce your performance. I don't think that that's going to be an issue with 99% of us. This was Olympic level athletes, or I think it was track and field athletes or high level endurance athletes. So I don't think it would be an issue, but I think it makes sense to kind of every other day or 2 days on, 1 day off, something along those lines. Hello. Do you want to say hi to everybody? Come over here. Yeah, come here. This is my better half.
Who are we talking to?
We're doing a BFR webinar. Yeah. Any other questions today? Yeah, we're cute. Most of the time. All right, you guys. Thank you so much. I'll see you next week. And if you have anything else, just send me an email at that same email address. I'm happy to answer. Bye for now.
here. She was over an area, so I was hoping she could.